My name is Nikki Hughes, and I'm from Blue Cross Blue Shield of Michigan, and I have the pleasure of working with your benefit team. And this morning we are going to go through the value that you get by being a Blue Cross member. And we'll talk about your medical and your dental benefits, as well as some wellness and health benefits that you may not be aware of. So here's the agenda of what we're going to go through in about the next 20 to 30 minutes. I'm going to start out by going over the benefits in your PPO medical plan. Then we're going to follow up and we're going to talk about your health and wellness, as well as I'm going to go through our Blue Cross website. If you haven't registered for our website, I highly encourage you to do that. There's a lot of information out there for you. We're going to follow up by going over the benefits of your dental plan, and then we're going to close out the session with a question and answer session. I know there might be a lot of questions that you have on both the medical and the dental plan. I do ask that if you can please hold your questions to the end. It's very possible that your questions will get answered during the presentation, but if not, we have a team up here and we're more than happy to answer those questions for you. Okay, so getting started, just want to let you know that with Blue Cross Blue Shield, we first want to thank you for having your health insurance and your dental insurance with us. We do value all of our members. And I want to let you know that we do have you covered. So you do have comprehensive benefits, and again, that's for both medical and dental. You have a preventative care benefit when you have your preventative care services covered at 100%, and we'll touch on that in more detail as well. And we have an unmatched access to doctors and hospitals. We have the largest PPO network both in Michigan and around the country. So you have coverage where you live here and anywhere you travel, whether you're traveling around the country or out of the country, we have you covered. So our network in Michigan, it does include 100% of hospitals and 98% of doctors. Around the country, you'll see that the national network does include 5,800 hospitals nationwide, and there are over 670,000 providers included in the Blue Cross network. And there's a few different ways that you can find a provider. Some of the easiest ways, and what might be most familiar for you, is to look on the back of your Blue Cross card. You can call the customer service number, or you can go to our website, which is here. It's bcbsm.com, and there's a doctor finder that will walk you through finding a doctor for whether it's just a general care doctor or a specialist if you're looking for that as well. Now I'm going to touch on the benefits of your medical plan. So with your City of Detroit medical plan, if you have one person on your plan, you have a $750 deductible, and I'll go through when you would pay that deductible. If you have a family plan, meaning if you're covering 2 or more people, that family deductible is $1,500. Now what that means is, let's say that you have a family of 3, and one person is seeking services. And I'll use the example if someone needs a surgery. That one person, their deductible stops once services add up to $750. Now as a family, the 3 of you, if maybe you have $500 worth of services, someone else has $600, just a family together works to get to that $1,500 family deductible. And I have some examples here of when you're going to pay that deductible. That would be if you are admitted into a hospital, if there's diagnostic testing that is non-routine, and also if there's x-rays that are non-routine. Now after that deductible is met, there is a co-insurance. And a good way to think about a co-insurance is a cost share. So what that means is after your deductible is met, Blue Cross will pay 80% or 80 cents on each dollar, and you'd be responsible for 20 cents of each dollar. Now when you're paying that 20 cents or 20%, that's not going to go on forever. So if you have a $100,000 bill, you're not going to pay 20% of that. That is limited until that 20% adds up to an additional $1,500 for one member, or as a family combined, that's going to be an additional $3,000. Now, there's also a total out-of-pocket limit to your exposure or your expenses in the year. So you might be wondering, okay, well, what's the difference between my total out-of-pocket and then the deductible and that co-insurance? This total out-of-pocket, it's like one big bucket for and everything that you're getting seen for, all of your covered services. So what that means is if you're going to a doctor's visit because you have a cold, or if you're hospitalized, or if you go to the emergency room, all of your services. And this does also include your pharmacy benefits that are through Caremark, when you're paying your co-pays for your prescriptions. Once those total up to $6,350, that happens in a calendar year, at that time, services are covered at 100%. So that limits your out-of-pocket expense. So God forbid if something serious did happen, you're not going to be continuously paying out-of-pocket for the rest of the year. Now I am saying the year, so I want to let you know that the out-of-pocket deductibles, they do reset January 1st of each year in your out-of-pocket maximum. Your preventative care services, I know I mentioned them once, but I just really want to let you know during this home that they are covered at 100%. And I have a brochure that I just want to share with you, and we do have this on our table outside. Now, preventative care services being covered at 100%, it's not something that just Blue Cross does. It's actually part of the Affordable Care Act, or you may have heard of a health insurance guidelines and laws that were passed a few years ago. But in this brochure that we have on our table outside, it lists the guidelines and the recommendations for your preventative care services. All of these services are covered at no cost to you. And these services include your annual maintenance exams such as physicals, well child checkups, immunizations, pap smears, PSA testing. Those are all considered preventative care and they are covered at 100%. As far as if you were to have an office visit, because let's say if you get a cold or you need to see a dermatologist, on your plan you have a $25 office visit copay. So you're paying $25 for that visit. And again, when you're paying $25, it does total up to, it counts towards that $6,350 or that total out-of-pocket maximum. If you were to go to an emergency room, you have a $100 copay for that visit. That copay, that is waived if you are admitted into an inpatient, as an inpatient, or if it's an accidental injury. Now you may notice in this chart that as far as for that $25 visit, just above that it also mentions urgent care. So if you were to use an urgent care facility opposed to a hospital emergency room, you're going to pay a $25 off, copay instead of a $100 copay. Okay, so now we're going to talk about customer service. So throughout the year, you might have questions about you might forget what your deductible is, or you don't know what your copays are. Just want you to know that we have a customer service department that is here. They are open Monday through Friday from 8 a.m. to 6 p.m. And here's the number that you can call for questions. Now you don't need to write this number down. It is the same number on the back of your card. Just want to let you know it's the same number on the back of your card. You also have other options. We know that your life does not just happen between 8 and 6, because if you're like me, you're probably at work during those hours. So if you do have questions after hours, there's a lot of information online that you might be able to answer your own questions or find that information just by going to our member website. We do have a pamphlet also at our table out there that talks about our member website and information you can find there, but I am going to go into more detail about that. But here are a few things that you can find also on our member website. You have access to a nurse line 24 hours a day, 7 days a week, all year round. This is nice because let's say you're at home and it's 9 o'clock at night, you just kind of been feeling sick all day, you don't think it's anything serious where you need to go to the emergency room, but you just have some symptoms and you don't know what it is, but you want to ask someone about it. You can call our 24-hour nurse line and they can go through the symptoms and talk with you about it, and they can give you a recommendation of, that might not be something that you need to go to the ER, you can wait and see your doctor about it tomorrow, or they might say, based on what you're telling me, you should go to the nearest emergency room. And I will tell you that this is a great benefit. I've used this line a lot myself. It's available to you and your family members, everyone that's on your plan. I will let you know that if you're calling for a family member, and let's say, especially another adult, they will want to talk to that individual in most situations. I'll give you an example. I called because, one of my family members was having heart pain. To me, heart pain, go to the ER. But like, no, I'm sure I'll be okay. And so I called the line, and they're asking me questions that I didn't know the answers to. And that's why it's important that that individual, if they can, that they call or they're right there with you so they can answer those questions for you. But in addition, our nurse line, you'll notice that there's other information here that they can help you with. Talk about the health and wellness tools that we have online. They can go through a depression screening with you over the phone. And they also can give you referrals to chronic condition management, pain management, case management, as well as complex case management. So you may be wondering, okay, I have Blue Cross Blue Shield, and maybe you're new to Blue Cross or you've had the coverage for a while, but you want to know what can you do to help reduce your out-of-pocket cost. Here are some tips that we have for you. First is always use a Blue Cross PPO provider. Now, as I mentioned, in Michigan, again, that's 100% of hospitals, 98% of doctors. So it's hard not to find a PPO provider. But we know that there are some providers that some might just decide they don't take any insurance. So I always recommend that you just check with your doctor first. You can do that on our website, or you can just call the doctor and just confirm that they take Blue Cross PPO insurance. I also recommend that you take a health assessment, and I'll show you another glimpse of that soon. Our online health assessment, this is purely for your benefit. There's no cost to you. It's through WebMD, and it only takes about, I'd say, maybe about 10 minutes to complete. And it just kind of goes through different questions about your health and wellness and some goals that you have. Also recommend that you register online on our website for your member portal, or kind of just view your benefits. And also, as I mentioned earlier, be sure to use your preventative care services. I can't recommend this enough. It's definitely a great benefit to you. It helps to make sure that you're staying healthy, that you are as healthy as you feel that you are, and that you believe that you are. Just go and get the routine exams. And it can help with early detection in case something does happen. So as far as our member website, online you can view benefits for your specific plan. So it will tell you, it will show your deductible, it will show your co-pays. So if you don't still have that booklet that you received at open enrollment, you can go to our website and it has the benefit information there for you. Also, you can review your explanation of benefits. If you're not sure what the explanation of benefits are, that's the form that you receive in the mail after you have services. So if you go to a doctor's office visit, or let's say you went to the emergency room, you'll get an explanation of benefits from Blue Cross. If you've signed up for the member website already and you've elected to have them pushed out to your member website, you'll receive an email to let you know when the explanation of benefits is available. That explanation of benefits on there, what it lists is it's going to list, this is a provider you saw, this is the date that you went, here's the cost of the services, here's our discounted PPO cost for it, here's what we paid, and here's your responsibility. So it's just going to break it down for you, which is nice because if you do receive a follow-up bill from a doctor or hospital, you want to make sure that you're matching that up with the explanation of benefits, just to make sure that they're in sync and that you're not being overcharged. Also, online you can order ID cards. So if you have a child on your plan, maybe a student that's away at college, and they misplace their ID cards, or maybe, let's just say you need more than 2 ID cards, you can go online and you can order that and it will be sent to you. Also on our member website, you can search for doctors, and we'll talk a little bit more about that, but it's nice because you can look for a doctor in your area, or you can, if you're looking for a particular specialty, you can search that up as well. And it's nice because you can view costs for treatments online. We do have health and wellness tips, as well as the health assessment that I mentioned. So here's information from our website that talks about our Find a Doctor tool. So with the Find a Doctor tool, it's nice because it's pretty straightforward, whereas if you can click on the button, find a doctor, it's gonna ask what type of plan you have. You say, I have a group PPO plan, and then it lets you start searching. You can put in your zip code, or you can put in your doctor's name if you just wanna look up him or her. There's a few different options that you have to find the doctor. Now in this screen particularly, what I wanted to mention here is this, as you can see here, or you may not be able to see, I apologize if you can, but in step 3, the first thing that the user did is they put in their zip code. Said, I want to find someone who's within 25 miles from me, and I do have a group PPO plan. And then at the step 3 said, what are you looking for? And they put in knee. So they're just having an issue with the knee that they want to see a specialist for. It will pull up providers, and it will also give, it will show different treatments, and it will give costs for those different treatments, so you can compare costs there. So you can make sure that you're getting the most value for the dollar that you're spending. So this is our website. This is a homepage. This is what you'd see if you were to go to bcbsm.com. When you're there, you'll notice that that there's going to be a login box, and you're going to log in as a member to view your health insurance. If you have not registered yet, there's going to be an option to register. And just in case if it's later today or next week and you don't remember what the website is, if you pick up one of these pamphlets from our table outside, on the back, it gives you the website of where to register. It only takes a couple minutes. If you ever forget your password, it will email it to you and let you, email you a link and let you set up a new password. It's very quick, it's easy, it's convenient, so I recommend you look into that. So once you log into the website, and this is just a demo, an example, so this is not going to match what your information would say. So looking here, on your home page, you're going to notice it's going to show how much you paid out of pocket, or how far you have to go, or how far you met your deductible, and your out-of-pocket maximum for yourself and your family members if you're covering other individuals. Also on the website, it will show you all the family members that you're covering and how much each individual has met towards their deductible and their co-insurance. And you'll also notice here on the screen how it shows you can get an ID card. So if you needed to request an ID card, you would just click that link and request an ID card. So you can do that instead of having to call customer service to do so. Now, also on our website, I mentioned health and wellness. Our health and wellness program is powered by WebMD. And again, this is something that you have that's included in your health plan. It's for you, it's available for you to use today. So when you're on the member website, there's going to be a little tab under the get your ID card. It's going to say health and wellness, learn more. You click on that and you're going to get to this page. And it's going to talk about healthy living. It's really nice because there's a lot of health tips out there. There's articles that you can read. And you can also take your health assessment. So if you click to take your health assessment, you'll see that gives you an option to take it now. And it's going to go through a questionnaire for you, with you. And like I said, it only takes about 10 minutes. It's very quick. And it asks you questions about your lifestyle, kind of your habits, and also what I like about it, it does look at areas of health risks, and it also asks what you want to improve. So it's not going to say that you need to exercise more if you don't indicate that you want to start exercising more. That's not going to be the primary topic that it lists for you. But let's say that you indicate that you want to find ways to relieve stress. That's going to be the type priority that it indicates, and it will give tips to you of how you can do that. And if you elect to do so, they can also send emails to you. I believe it's maybe about once a week or once every couple weeks, just about tips, again, to keep you on track with the health goals that you set for yourself. Now, also just one thing I want to mention, this you can find in the member website, or if you just go to our Blue Cross website and you click on that Find a Doctor tool. One really nice thing is that we have hospital quality reports that you have access to. And what I mean by that is you can type in a hospital, let's say there's a procedure that you need to get done, and you know it's something that you need to get done, but you don't know the best place to get it. You can look at the hospital quality reports, And in this example, St. John Hospital Medical Center that was used. And it's going to tell you different awards that the hospital has won, or I should say that they've earned. And basically the information listed here, it's based on Blue Cross, some rigorous standards that we have, and also public data that's available to you. So here you'll notice where it says Blue Distinction Center. So we do have Blue Distinction Centers, and what those are is we rate hospitals based on a lot of different criteria and for specific services, such as cardiac care. Let's see, there's a few more. Spine surgery, treatment for complex cases of cancer, and also transplant. So there's about 6 different areas that we rate hospitals on, and if they meet criteria and it's kind of low rate of readmission and a few other guidelines, they are awarded our Blue Distinction Center. So that's something nice that you can look for when you're online. Now let's talk about the discounts that you get by being a Blue Cross member. We have health and wellness programs, and a lot of discounts you get just by showing your Blue Cross card at different places. On the table out there, we do have more information on our, call it Healthy Blue Extras, and our Blue 365 program. We're in the middle of transitioning the program, so it's just known as Blue 365, and that will happen in July. But the nice thing is that whether it's in Michigan or around the country, there's a lot of discounts available to you. So here's a few here. It has door-to-door organics if you want to get food shipped to your home. You can get discounts at places such as Reebok. Also, it's nice because you'll notice here that it talks about Healthways, Fitness Your Way. You can get a $25 a month gym membership, and you can use that at several facilities around the country. It shows you have access to over 9,000 gyms. In addition, it shows that you have up to 30% discounts on over 40,000 wellness services, such as acupuncture and yoga. Okay, so now I'm going to turn this over to Doug Zalecki, and he's going to go over the Blue Cross dental benefit that you have.
Thanks, Nikki. Good morning, everyone. I'm just going to do a little brief overview of the dental plan, some things about the network, key points in that, and then we have some information out on the table you guys leave to pick up. So, first of all, we want to establish that there's a link between dental health and medical health. So what we do here at Blue Cross is that we take a look at your medical claims, and the people that might have conditions like diabetes, heart disease, expectant mothers, children from the ages of 5 to 16, newborns. We take a look at them on a medical basis, and how does that relate to dental and the integration of taking a look at the dental and how can it affect their health. So a couple ways we do that. We look at premature births in the nation, and then you can see it's about 11.9%. So why is that important? So that expected mother, she needs to make sure the bacteria that's in her mouth is not affecting her unborn baby yet. So what we do is we encourage her to go to the dentist to make sure she's getting her 2 cleanings a year, her oral exam, and her bite wing x-rays. Same thing with people that are diabetic. We're looking at that population, identifying those members and encourage them through communications, brochures, so that we can go ahead and help them manage their diabetes and also manage their dental through that. In cardiac care, the same way with that. Being this multi-line carrier, Blue Cross and Blue Shield of Michigan is, because we have the medical data, we can integrate that into the dental and help the member out more. More people go see a dentist than they end up seeing their primary care physician. So this is one way that we can go ahead and touch somebody. We're going to go ahead and do that. All right, so some results of us touching members, and this is on our book of business. These pieces down here are examples of what we sent out last year in 2015 to our members. So I said we target members who are expected. So we send on a monthly basis when we find out the mother's expecting. Make sure that you're going a nice little thank you, congratulations. Please make sure you're going to the dentist. For children that are 1 year old, we send them a birthday card, just basically telling the parents, listen, they might not need dental care, but it's a good idea to go there. Have the dentist check out your baby's mouth, make sure you're brushing the gums with a rubber finger toothbrush so that no bacteria builds up in that. And then the same thing when it comes to, I talked about children who may be between the ages of 15 and 16 years old. That's the most time they're drinking sugary drinks. So what do we want to do? We want to make sure they get sealants put on their teeth. That prevents tooth decay, fillings, and then as us as adults, all crowns. So here's some results, and just going over the first one. 29% of the members with cardiovascular disease, after 12 months was up, we sent out a brochure to them indicating that you need to go see a dentist. Well, 29% of the ones that we sent out actually stopped and made an appointment. So this is going to be starting our 4th year with this. So 3 years ago, that number was at 18%. And this is really encouraging because, you know, we all get stuff in the mail, and where does it go? Right in the trash, right? So we're happy that members are actually taking a look at this information and making a conscious effort to go ahead and make a difference in their life and make that appointment for the dentist. So member education. So we got the outreach mailers that go out for the brochures. We also have a medical or a dental wellness site called Blue Dental Connection. So this site I like because it has a copy of all those communications that go out to the members. Here's an actual brochure on it, so it's at the table when you go out, so you can pick one up. But in this website, what I like about it is that, so it talks about dental conditions that can affect your health, but also has a place where you can go find a dentist, which is very important. You can ask a dentist a question. So let's say you have a question about a procedure. You can go on this website, ask the question, the dentist will answer you within 2 hours. There's a dental dictionary out there. So if I said to everybody in the room, you know what a silver filling is, right? But if I asked you, do you know what an amalgamated filling is? It's a silver filling. It's just the proper name for it. So what I like about the dictionary, it gives you the proper name, it also gives you the slang name for it. And that way, it's just a way to be educated. It also has a risk assessment. So let's say you never had a root canal. So you can look at pictures, you can look at a video of what a root canal is. And then the last piece out there, what I like, is there a cost advisor out there. So WebMD powers that for us, and that cost advisor you can put in, I need a crown, or put in a procedure code for a crown, and it will give you a range at a PPO provider on how much that cost would be, and it would give you a range at a non-PPO provider, depending on where you live. So you punch in your zip code, city, and it'll give you that. Most people use this for, the cost advisor, is braces, orthodontia. So that's the #1 hit that the data shows out there for members looking at the cost of things. All right, to go over your dental benefits. So you have what we call a true PPO plan, and it's called active, meaning that in-network you get greater benefits than you do out-of-network. And there's another good little piece out there on the table, and this basically just tells you what a PPO plan is and how it works. So when you're on your way leaving, you can pick this up too. But to go over in-network. So in-network, you have Class 1 services are covered at 100%. And examples of that are cleanings, X-rays, bite wings, X-rays, excuse me. So this is where we encourage you to make sure you're going to the dentist. Keeping up your teeth in a healthy manner prevents you from using Class 2 services, Class 3 services. Class 2 services are covered at 80%. Examples of those are fillings, oral surgery, root canals. And then Class 3 services are covered at 50% in network. That would be crowns, dentures, implants. And then Class 4, of course, is orthodontics, and that's covered at 50%. But if you don't pick, you need to go to a PPO provider to get the in-network benefits. That's where the directory comes into play. You can go out there on the directory and search by only PPO providers. You can search by dentist name, city, zip code within a radius. Then out of network would be all other providers that are not PPO. And the same benefits are found in each of the classes, but as you can see, your coinsurance levels are different. They're 50% across the board. So you only get 50% coverage on class 1, 2, 3, and 4. The other 50% is what you're paying for. To get the best benefit, just stay in network for your PPO. Okay? You can go on, please. So this is just the same thing basically Nikki was saying. When you go into bcdsm.com, this is the way you would go in. You can locate a dentist under Blue Dental. You can get to the Blue Dental connection, the wellness site right there. When you do log in as a member, it will show you your medical claims. It'll also show you your dental claims and what you've used too. And it'll do it for each member of your family. Okay. And then I just wanted to give you some stats about unique dentists in these 5 counties. So you can see under our PPO network, there's just over 1,000 PPO providers in Wayne County, just under 1,000 in Oakland, Macomb, Washtenaw, and Livingston County. Okay. Effective 7/1 of 2016, we're actually adding another network to our PPO current network, which will be about another additional 300 unique providers in the state. So we're always trying to add more, and especially to areas that are more suburban and rural locations. We feel in a lot of our urban settings, we do have a lot of dentists to choose from, but as you go out, it becomes less and less PPO providers. And a lot of times that's because that's the only dentist in town type of deal. So we are always trying to do that. So I just wanted to kind of give you a snapshot of how many dentists are actually out there in these 5 counties. Okay. And then that's all I had on dental. So I think we'll field any questions anybody has.